When we sit with an agency and we learn about how they operate to make sure that they don't feel like we're not coming to try and disrupt your day to day. We're trying to optimize it. I'm not uprooting their operational beliefs. I'm rather adopting my software to their operational values and beliefs.
Thank you for joining us on today's podcast. For the listeners, we have Tsvi, EVP of Bolt Healthcare, joining us today. Tsvi, thanks for making some time to chat with me today.
It's my pleasure. I've been looking forward to getting together with you. I saw the work you've been doing on LinkedIn and across some socials, and looks like a really great opportunity. I'm excited to be here.
Amazing. Likewise. And so to start things off, like you see, like me, have been working in healthcare you've been doing it for over a decade, and you now lead up sales growth at Bolt Healthcare. You're the EVP of the team. What first drew you into the home care space, and what keeps you focused here today in that home care space?
So I honestly kind of started out in home care. I actually had my own startup that I was working. It was more of an ed tech platform. And I had some conversations with people at Bolt Healthcare, and they had a need that really wasn't being met. It was in the really early stages of the company, of their growth, when they had just about, 15 or 20 clients or so. And I felt like, hey, this could be something that I really see value in. The fact that I get to actually affect people's lives on a day-to-day basis and impact in a positive way or make a difference in a positive way. I think that's really kind of what drew me into the healthcare home care space. With Bolt, we have a lot of different things that we do. And as I've stayed in this industry and gotten to know more and more people, whether it's in New York or in the 25 other states that we're operating in, I've learned that home care in the community, it's really like a family. And everybody in the industry is there to support each other, and we'd like to see success. Whereas in other industries that I've been a part of, I think it's kind of differed from that, where the competitors or the other providers in the industry or in the space want to see you fall as opposed to succeed. So I think that's kind of what really drew me in initially. And then following up on that made me fall in love with the space and really dedicate my time 100% to it.
That's powerful. And this is a space that's growing fast, and it's unfolding right in front of our eyes. We have, I think, a big thing from what I've learned from your guys' work is the pre-service side, all the intake, the marketing, the hiring for home care. That's where things kind of fall apart, Where do agencies get stuck the most, and what are some of those effects in the market today that you guys are helping address?
For sure. I like to call that the home care bottleneck, right? I mean, in this industry, it's all about the agency being able to get in front of that client. And I think when people make a decision of, hey, am I looking for home care or do I want to go to a nursing home? There are a lot of differentiating factors that come into making that decision. And what I've found is that a lot of times people are getting in a nursing home. It's like a 1-to-3 type of care ratio, where it's one caretaker for every 3 patients rather. Whereas when you're in your home, you're maintaining that comfort level of being in your home, in your comfort zone, and you're getting that one-to-one care. So you're actually developing a relationship with that caretaker. And I think that is really where it all starts, right? The bottleneck that I referred to earlier, I think that was because of a lack of knowledge or tools available in the industry. And this goes back 10 years, where people were marketing their agencies and getting out to the prospective consumer and saying, hey, we offer this service, a one-to-one service in your home. And the problem was that because there's no real tool in place at that time to allow for the agencies to follow up and to maintain a consistent relationship, oftentimes these people that really, really need that care or service were falling through the cracks. And that led to the agencies not being able to service these clients, and clients not receiving services that they really so desperately needed, right? And then much more recently, there's been, I guess, since COVID, a really big caregiver shortage. And I think a lot of the focus has shifted on maintaining the relationship as well with that caregiver, because at the end of the day, they're the engine that keeps this industry going. Without these amazing caretakers and the workforce that we have in this industry, nobody's going to be receiving that service, and there's not anybody to help so many people across the country, really across the nation. So what our goal was to come in and say, hey, this is a bottleneck. This is an issue that not one agency is facing, but literally the thousands and thousands of agencies and the millions of patients in the United States are dealing with. Now, how can we address that issue? How can we get down to the root cause and say, hey, we now have a solution that we can provide to these agencies that effectively eliminates that bottleneck and allows for the agency to maintain and build that relationship with not only the client or the patient, but with that caregiver as well. And having all of that in one ecosystem, whether it be with some of our partner providers or partner companies that we like to work with, it really creates the end-to-end solution for that agency. And it really optimizes their workforce, their workflow, and eliminates those falling through the cracks of patients or those caregivers, effectively leading to a higher start of care percentage.
Fascinating. So it really, this bottleneck comes down to like the pre-service side, because and the why is like these home care agencies. Is it fair to say like they rely a lot on like referrals? So like on the pre-service side, it's like all their intake, like marketing, hiring, is typically done on a referral basis. Like they don't know how to go out to prospective patients, or like you said, the ones that like actually need the service, Is that
Exactly.
where the bottleneck is? Okay.
So it starts with that referral process. Sometimes after that start of care happens, there are things that transpire, whether there are codes with their insurances that are preventing the continuation of care, or the caregivers maintaining their compliance and eligibility to continue to provide service. So that's really where we come in. That bottleneck for the clients in Bolt, specifically the way that we've created it, is that no matter which way you're engaging with that client or that prospect patient, there's a way for our solution, Bolt Healthcare, to actually catch that information, create that profile, auto-populate follow-ups, and then allow, from an executive standpoint, for you to see exactly where the discrepancies are. If we lost a referral, why? Was that because we messed up somewhere internally, or was that something that we had no control over? So it was really about, one, implementing the solution that addresses the direct needs and pain points that the agencies are dealing with on a day-to-day basis, while at the same time making it as easy as possible for a patient to come to the agency, sign up for services, request more information, as well as that caregiver then applying. Whereas traditionally, for example, an application process, a caregiver has to get on a bus, and I'm speaking more specifically about New York now, right? We're a very densely populated area. And oftentimes, if you want to apply for a position or for a role at one of these agencies, you're getting on a bus for an hour and a half to go sit in an office for 2 hours, fill out paperwork manually that more often than not is going to have some errors, because we're dealing with a lot of different demographics, different language speakers. So maybe English isn't their first language. So when they're looking at an application form, wow, how do I fill this out? And I have a 50-page application now that I need to complete with all of these info points, where we take it and we make it a very easy and seamless process. That caregiver can scan a code, click a link. Now they're applying for your role. All of their information is pre-filled to their form. All they have to do is sign and save. And the agency then just hires that right there and then. It really cuts that process out, eliminates a lot of that legwork or the nitty-gritty, mundane administrative tasks that need to get done by your team, and allows you to effectively hire faster, onboard quicker, maintain compliance, and ensure that we actually have the caretakers to meet the demand of patients that is out there.
I see. Yeah. Yeah. I mean, because it sounds like a lot of your guys' focus is entirely on this pre-service operational side. And you just gave this example of how it looks in the field, right? But there's a lot of these like home care like platforms out there in the market, right? How would you guys say yours, like, what do you guys do differently that allows these agencies to use you guys in the field? Like, can you walk me through an
Sure.
example of how that
Of
looks?
course. So oftentimes when you say like there's a lot of the home care solutions, it's usually more focused on the clinical or post onboard or post hire environment. It's all about the billing, the scheduling, making sure that the caregiver is coming on site, providing the service, all around that, right? I like to use the analogy that home care is kind of like I can go to the supermarket, take some apples, put them in my basket, and check out. And that's what those EMRs or EHRs and these big companies that we actually partner with, a ton of them, are offering. I like to say we're the orchard. So we're planting those trees in the backyard so that you could go and say, hey, I have this 1,000 lead platform in my system right now, and all these people are in my pipeline. How do I maintain those relationships? How do I ensure that I'm following up? How do I ensure steady communication? How do I make sure that they're comfortable with our company? We're more of a purpose-built pre-service onboarding platform that is designated specifically for home care. And we've been actually branching out into a lot of the other healthcare avenues, which is really exciting as well because of how customizable our solution is. So another thing that I think sometimes people will think about during a process of, hey, what platform is right for me? Oftentimes, the competitor is, let's say, a Salesforce type of solution where you have to come in, dedicate hefty amounts of money, resources, time, and effort in order to get a working product.
Right.
We're a purpose-built, out-of-the-box solution servicing, hundreds of agencies today. And each agency has full customization capabilities. So we build out our platform to match the unique nuances, wants, and needs of each agency, whether it be what they call the service that they're providing, whether it be the steps that they have to go through in order to provide that service, the communication methods, taking them completely digital. These are all things that if you're in 2025 not on an electronic platform or a software or system that allows you to manage that caseload or workload in conjunction with whatever EMR or EHR you're using, it's going to allow for a lot of shortcomings or fall throughs in terms of your service.
Interesting. Yeah, I love this analogy that you gave. We're the orchard, like that I think summed it up well in terms of like how you guys approach it differently. Because like you said, there's a lot of like post-hire like EHR systems out there in the market. I think a big one like HHAeXchange, AlayaCare. It sounds like you guys are really able to, you partner with these tools and complement them. And you guys really fit in on the pre-service side, like the orchard example, like actually like getting the apple, like planting the apples and getting the apples before you go and check them out,
Exactly. We're cultivating it. We're making sure that the agency have the tools at their disposal that they need in order to get that patient into the HHAeXchange or AlayaCare. Like we actually are partnered with both of those. They're both amazing systems and really great at what they do. Obviously, different agencies have different preferences, which is fine in terms of the systems that they're using. But at the end of the day, whether it's HHAeXchange or whether it's AlayaCare, any other of that type of platform, both is going to sit in front of that. It's going to literally bolt your agency forward, right? It's going to allow you to manage your workload. It's going to allow you to ensure that the patients that you're receiving are actually going through on service, ultimately to go into a EMR, EHR type of system where you can then, manage the clinical side of that life cycle.
Right. And at the end of the day, I mean, would you say this is what sort of, like you said, bolts forward agencies? Because like, if they don't have proper intake, like everything on the pre-service side, intake, marketing, hiring, etc., like they won't be able to grow as an agency. Like I actually had an agency call me like over a month ago now, and it was a leader of agencies like, hey, like I need help like getting more like private pay patients. Like how do I do that? And hence like a solution like your guys's, I'm sure could like be beneficial for agencies like that may want to branch out into like is that part of what you guys do? Like help like say like, okay, I want to branch out to the Medicaid population in this geography, or like private pay patients, like commercial, patients. Is your solution able to kind of like go after those different like targeted populations?
Sure. So we could manage and accommodate or create workflows for any service offering that an agency is looking to get into. We're not going to go and run your search engine optimization or your Google campaigns and your marketing campaigns, but we're going to provide you the tools that once those campaigns are up and running, you're tracking your ROI on those. So if, for example, you want to do a private pay, I can direct you to a really great campaign manager that's going to drive a lot of referrals and stream to your business. But ultimately, what are you then doing with that? Do you have something core in your business that's going to ingest all of that information and then give you your ROI analytics, show you what your close rate is for let's call it, you got 100 leads now from private pay. How are you monetizing that? Or how are you going to take those leads and ensure that they're going through and getting that start of care? What process are you implementing? Are you ensuring that the relationships are actually as valuable as they are, right? I can have a referral source sending me 100 private pay cases and only one will go on service because they're not good qualified candidates. Whereas I have somebody else that might be sending me, 5 or 6 referrals a month, but each of those referrals are good qualified candidates. Now,
Mm,
how can I allocate my resources more effectively to drive the best traffic and ultimately the highest conversion? And that's really where we strive. When it comes to those high-end executive KPI data points or analytics that you would need to effectively run that company.
that's a great explanation. I think that really sums up like how you guys really you're more than just a orchard, but also like the actual like conversion engine for agencies, right? Like helping them get a sense of like, okay, like this is the sort of people population I want to focus on for intake, but then like how did it convert for us, and then how do I set up my hiring around it, so that we're growing as a business. So it makes a lot of sense. And
Exactly.
yeah. And then from what you're like seeing or like hearing in the field, because you're in the field yourself, like what is like getting in the way of adoption for like agencies to adopt like bulk healthcare, and how are you guys helping them work around that?
So I think something that we've done was almost about 2 years ago now. When we first started, we didn't really have that. We were just doing onboarding, on a case by case basis. But what we've identified was that oftentimes managers know home care, but they don't know software. So it's hard for them to say, hey, how do I bridge that gap? So proactively, what we did in order to directly address that concern for a lot of the agencies was we went out and hired actually top tier individuals and C-suite executives that have worked at some really large home care operations and have a vast experience in the space. So they've actually successfully implemented Bolt at a lot of their previous agencies where they worked. So they have a really profound and in-depth understanding and knowledge of Bolt as a software fundamentally, but also of the direct needs of an agency, right? And when I say direct needs of an agency, there's a lot of contrast there because an executive or a CEO, for example, they might not really care about the nitty gritty happening by the intake team. They care about the results. So we had to make sure that we're tailoring a reporting dashboard that those executives can go and at a bird's eye view see everything happening across the board. But from an end user perspective, something that's going to be super user friendly and simple where anybody could come in, the system literally holds your hand and guides you as to what your process is. And our team sits with you to really learn and understand fundamentally how your business is operating and what your needs are from an executive standpoint, from an end user standpoint. And then we build out the module and the tool to actually address that directly. And since that client success team has been on board, it's really been a game changer, I think, because you're paying lots of money generally for consultants outside of the agency, right? And I'm talking tens of thousands of dollars, and we're providing that service pro bono.
Wow. I mean, talk about that's your guys' like top of the funnel value in a sense, And like the key thing I heard there is like you said, like like managers in the home care space like know the home care, but they don't know software. It sounds like you guys are really able to cater to the different bodies that work in that agency, because like a C-suite or like an operational leader will want to see different information than like the actual like care delivery like managers or like the caregivers that go into the home, And so
Exactly.
yeah, it makes a lot of sense. Can you like walk us through like an example of, how you guys like change either intake, like hiring or marketing for one of the agencies you work with and what the
Sure.
overall impact was?
Sure. So really, the wheel, like I like to say, if it ain't broke, don't fix it, right? When you have a process that works, that's ultimately what we want to maintain. Now, what we figured out was it's about how do we adopt that process into Bolt and maximize the efficiency and eliminate the administrative or additional legwork or tasks that are needed that oftentimes create the bottleneck or will create a loss for that agency. So it was really important when we go and when we sit with an agency and we learn about how they operate to make sure that they don't feel like, hey, we're coming in and we're changing and uprooting your operation. This is not how you work anymore. You have to do it this way or that way, which is what a lot of other systems are now pushing, right? They're very rigid. Hey, this is our workflow process. And when you sign up with us, you're bound to this workflow process. You're not changing it. Oh, you want your paperwork in the system? No, you have to use our documents that are pre-filled into the solution. Whereas we come in and we're saying, hey, no, this is your baby. We're not coming to try and disrupt your day to day. We're trying to optimize it, right? So what are you doing today? How is this working? Oh, this looks like an extra step. Common practice is this. If you want it, it can be there. But ultimately, I think it would be better for your operations if you took this out or you put it here, for example. And once we start to do that and the teams really understand, hey, they're really doing what we need here, right? This is my paperwork. It's the same paperwork that I'm used to processing for the past 7 years that I've been with this agency. I'm not uprooting their operational beliefs. I'm rather adopting my software to their operational values and beliefs. And when you do that fundamentally and you show the team that you're there with them, very hands-on with them and always there to help, whether it's a tweak here, whether it's a tweak there, whether you need to update a document or make this change, our support team is really hands-on and on top of it and easily accessible. It's not like other systems that you're waiting on hold for days or weeks at a time for somebody to call you back. By us, you have your client success team, you have your support managers, you have myself and my team, and there's always somebody that you can call. Someone's going to pick up the phone, speak to you, and work through whatever it is that you're dealing with, and always make sure that the result is satisfactory.
Yeah, well said. I mean, it really, I think what I just heard there is which is a key distinction, and I think I maybe like represented like changing the workflow. You guys aren't there to change the workflow. You know, like you're like in Bolt, it sounds like you've already adopted the workflows that work for these agencies. You're just helping them improve it and make it better, like day to day, week to week. You know, and have you found like commonalities though, and like the types of workflows that you guys have built
Of
across
course.
these? Like, what's an example of those beyond just
So
like,
at
yeah,
the end of the day, it's like, honestly, it varies state to state, right? I have, like I said, hundreds of agencies that are using Bolt, and I don't think there are two agencies that have the same setup unless it's the same ownership. So generally, like in New York, for example, right, if you have a long-term case, effectively the mandated guidelines by the state, those aren't really going to change, right? So we do offer best practice based off of what a majority of our agencies are doing and the way that they're processing those cases. But at the end of the day, every operator works in their own unique way. And it's really important for us to make sure that they understand that, okay, this can be something that we would recommend, but hey, this might not be what works for you. And if this isn't your process, then we'll adapt your process and make sure that that's what works for you. And I think that's really the differentiator and where that value is. And if they want to use our workflows, they can use whatever we have. But if they want to make those changes, it's solely at their discretion.
interesting. What do you say? There's a lot of variability from like state to state, like even like New York compared to like an adjacent state like New Jersey or PA.
Oh yeah.
Yeah.
It's really very verbiage based. A lot of differences, I guess, in the way that they're verifying or the insurance capabilities or the plans or the contracts that they're dealing with, who's paying out the case. That varies on a state to state basis. But then also the different types of services. Is it skilled? Is it non-skilled? Are we doing more private pay? Right. And I think when you say non-skilled, it's just different verbiage. And at the end of the day, it's kind of like the same 5 steps that every agency is going through. It's just framed a little bit differently. But in the skilled world, right, on a state to state basis, things may vary really drastically. But what we've found is because, we've been really rapidly expanding into all of these other markets, and because of how customizable the solution is, right, whether it's another state or another industry, we're able to accommodate those shifts or those needs for you.
And that accommodation takes into account like their patient mix too, because in the home care agency space, like I imagine like they're not like they don't have one density of like patient population. They may have different, ones. Like they may have groups of Medicaid patients or groups of private pay patients, or you have your agencies that just do like private pay or just do
So it's a mix.
Yeah.
It's really a mix. And I think you brought up something really important with the different demographics that you're dealing with, which is why in our system, for example, with the caregiver demographics, a lot of the caregivers that are now working as these types of employees or caretakers, oftentimes English is not their first language. So it was about making sure that we could accommodate that discrepancy, right? So if I'm a caregiver and my first language is Spanish, I can't do an application in English. It might be hard for me, or I don't know what all of these things mean. So in our system, they could literally select the dropdown. What language are you speaking? Great. Now that entire form is going to be completed in your native tongue. So it makes that familiarity even higher. And it really creates more of a caregiver engagement because they understand that the agency is there for them and really understands, hey, this is what the caregivers need. So we're going to provide that for them.
Interesting. And earlier you mentioned that like you guys work with a lot of the major like platforms on the service side, like HHAeXchange, AlayaCare, et cetera. But like if I'm an agency owner, you know, and I know my workflows on the pre-service side aren't truly optimized, I see that there's areas of improvement, and I want to like acquire something like a Bolt. Like, do I have to then go log into the like separate portals, you know, for a Bolt, or does it all sit in like one area for me? You know, how does
No,
that work?
everything's in one place. Everything's in one place. We have seamless integrations with all of those partners. We're able to run reports and pull data, for example, with eligibility for your clients on an automated level. It allows you for a very easy user experience and ecosystem.
Amazing. And where do you see this space going? I mean, there's a lot of change happening right now as we're speaking in the Medicaid space, you know?
Oh, yeah.
Not going to impact anything you guys do, not just with like in terms of delivery, but also how are you guys going to do anything differently moving forward to cater to that, you know, your agency serving Medicaid patients?
So at the end of the day, it's very simple. It's about there are agencies that their sole job or purpose is to go and serve this community and serve the people that need to receive services, whether it's skilled, non-skilled, or private pay. Our tool isn't really going to change much because that flow is still there. The need for the service is still there, and the need for agencies to onboard those clients and ultimately provide that service is still going to be there. When it comes to the shifts in, for example, like in New York with the whole CD situation, there are still people that are receiving that service or being now qualifying for different types of services. So at the end of the day, the agencies are still around. They're still going to be providing services, whether it's through a subsidiary, whether it's through, you know, a contractor, for example. But at the end of the day, Bolt is going to be the solution that's going to get you from point A to Z.
Well said again. Yeah. I mean, it really sounds like you guys stay up to date with the latest workflows, you know, and guidelines that are available state by state, because there's changes in that occurring as we're talking, you know, so.
Oh, yeah. I like to say we set the standard.
So on that point of like setting the standard for like, you know, home care agencies, like potential partners, like listening to this that want to connect or even like explore bolting forward, you know, with their pre-service operations, like what's the best way for them to reach out to you and your team online?
So generally, you can reach out to us on LinkedIn. You can find myself, Tsvi Vilinsky, on LinkedIn, or you can hit Bolt Healthcare on LinkedIn. You could always send us an email on our website, the contact form. I actually oversee all of that. So if you needed to get through to me, you can do that. You know, and my contact information is really everywhere. You know, I could give you my cell phone if that works. I don't know if.
Yeah, I mean, if I think folks in the home care space are very like phone based, right? So we can link
So
that.
give me a call. Give me a call. 917-474-6865. We're here to help you in any way possible.
Love it. There you go, folks. You heard him. You know, if you are in the home care space and need support on the pre-service side, Tsvi's the man to reach. So we'll make sure to include that, like all the social links in your number for sure, and in the podcast, like comments below. So yeah, Tsvi, it was a pleasure speaking to you today. I think this is a really interesting space that you guys are in. I think there's a lot of change coming in the industry as a whole and in the types of guidelines and standards that are coming, but you guys really are staying up to date with it from what I'm hearing, and have really nailed this niche within a niche, really, you know, which is powerful, which, you know, not a lot of companies can say they do. You know, there's a lot of companies that say, hey, we do a lot of the home care platform post-service, but you guys have really narrowed it on. You saw this need on the pre-service side, and from everything I've heard today, it really sounds like you guys are making a positive impact in different communities. So excited to keep that.
And we want to continue doing that. We're growing into a lot of different states and different markets and even different sectors. So like we're getting into a lot of the behavioral health world now, mental health, HCBS, right? Whereas home care is traditionally for elderly. We're getting into a lot of the pediatric as well. So there's a lot of different ways and avenues or services that we can help streamline. So that's really
right on. I'm glad you touched on that. Yeah. Oh, right on.
Yes, sir.
All right. Well, hey, it was a pleasure
Awesome.
speaking. Thanks for making some time on the podcast today. And I really enjoyed our chat, and we'll 100% keep tabs on Bolt and bolting forward. So,
Awesome.
I'm sure there'll be a lot
It was-
more examples and stories coming of agencies that have used Bolt,
Yes, sir. It was a pleasure being here and speaking with you. Thanks for the opportunity, and I look forward to see what's to come with this podcast. It was a really awesome experience. Highly recommend
Likewise.
to any other people looking to jump on.
Likewise. Yeah. I appreciate the kind words, and we'll stay in touch. Thanks, V.
Awesome.